Hello dear friends, welcome to Pharmaceutics Recalls discussion. Starting with question number 41, the combination of preservatives that appears to be most effective for ophthalmic use consists of. The options are benzalkonium chloride and editate, benzalkonium chloride and chlorbutanol, chlorbutanol and EDTA, methyl and propyl paraben, phenyl mercuric nitrate and phenyl ethyl alcohol. Here the correct answer is option A, that is benzalkonium chloride and editate. In the question they have asked about the most effective preservative for ophthalmic use. Okay, so preservatives provide important and necessary antimicrobial activity and are crucial in maintaining sterility and extending the shelf life of multi-dose formulations of topical ophthalmic medications. Preservatives for ophthalmic medications or preparations include benzalkonium chloride, chlorhexidine, methyl paraben, propyl paraben, ethylene diamine tetraacetic acid, that is EDTA, and sorbic acid. So out of these preservatives, benzalkonium chloride is the most widely used preservative. Next question. A patient purchasing sublingual nitroglycerin tablets should be told to store the medication. The options are in the refrigerator, in a plastic vial with a child-proof cap, with the original cotton, in an amber glass bottle with a metal cap, in a warm, dry place. So in the question they have asked about the patient counseling point for a patient purchasing sublingual nitroglycerin tablets. Here the correct answer is option D. That is, due to its volatility, sublingual nitroglycerin must be stored in an amber glass vials with metal screw top caps. Question number 43. Which technique is typically used to mill camphor? The options are trituration, levitation, pulverization by intervention, geometric dilution, attrition. Here the correct answer is option C, that is pulverization by intervention is the milling technique that is used for substances that are gummy and tend to re-agglomerate or resist grinding. For example, camphor, iodine. Next question. When describing solubility terms, greater than 10,000 parts of solvent for 1 part of solute would be called. The options are very soluble, soluble, sparingly soluble, slightly soluble, practically insoluble or insoluble. So here the correct answer is option E, that is practically insoluble or insoluble. More than 10,000 parts of solvent per 1 part of solute is considered practically insoluble or insoluble. Question number 45. A humectant retards. The options are bacterial growth, degradation, surface evaporation, spreadability, all of the above. Here the correct answer is option C, that is surface evaporation. A humectant such as glycerin helps to retain moisture and prevent drying due to evaporation. So hence came the option surface evaporation, that is a humectant retards surface evaporation and helps to retain moisture in the skin. So with this question we have completed today's recalls discussion. Thank you for watching this video. Have a nice day.